Eating disorders and issues with weight are things that can happen to anybody. And the Sanford Eating Disorder and Weight Management Center has options to help everyone here with that. And we are presented with the nurse practitioners, Morgan and Katie. Welcome.
Thanks for having us.
Thanks for being here. So tell us a little bit about weight management and your things that are privy to that.
Yeah, so at our center, we talk to all sorts of patients, anyone who's discouraged with having difficulty with weight loss, or maybe they're needing to lose weight for other comorbidities they have, heart disease, diabetes, polycystic ovarian syndrome. A lot of our patients in the community are struggling with weight loss, and we're here to kind of lend a hand and help out with maybe some medication management to help them lose weight.
So what are the types of patients that you guys frequent?
We see a lot of patients that have, from a wide variety, from patients who, have no medical comorbidities, just young, healthy people who want to try to lose weight and have maybe tried some different fad diets or what have you in the past that they maybe not had sustainable success. And to people who are maybe more a bit medically complex, maybe have some other medical conditions that they need to lose weight for. And so we see a very wide variety of people and just help people where they're at.
Wow, sounds like there's various components to this. So what are some of the other components that are associated with that?
So when patients first call to make an appointment with our clinic, they'll get scheduled for an introductory class that kind of goes over the components. But we have registered nurses who are health coaches who can really help patients throughout their entire journey. Their visits are free, which is a great resource for patients to help with that accountability piece. And then we have registered dietitians who will meet with the patients one-on-one and come up with more of a personalized diet ideas, tips, lifestyle things that they can do to help with weight loss. And then they'll also meet with one of our medical providers. Morgan and I are two of them. And we help prescribe medications to help make those lifestyle changes easier for patients to accomplish and help make those things more successful for them in the long term.
Wow, what are some great tips and advices that you can give someone who's facing an eating disorder?
Yeah, so oftentimes the things we really touch on, diet, exercise, we don't really promote any specific diets because a lot of fads are hard to stick with and just not sustainable, and we hear that all the time. So we really promote just a well-balanced diet, working on portion management, and no food is bad food, just trying to enjoy the things that you enjoy in life, just with moderation. We talk a lot about exercise, and what we find is some patients are really averse to going to a gym or don't have equipment at home, so we can talk with them about exercises that don't require any equipment or different things you can do in group settings. We started having group patient visits where we can give advice in a group setting, so it's a nice support group with that aspect as well.
Great accountability right there. So let me ask you, do I have to have a referral to come to the clinic?
Anybody can come to our clinic. You don't need a referral from your primary care provider or anything like that. The phone number that patients can call is 234-4111. And then the front desk will go over everything that they need to know. Insurance is a big question that we get a lot of the times, and so we really encourage patients to check with their own insurance about what they'll cover of the visits, and when they call to get the appointment scheduled, they can give them some of those various codes or things to look for.
Cool, that's comprehensive. So now if I have a dietary nutritionist, do I have a comprehensive plan that we go over as well?
Yeah, so the dietitian will give their lending hand in it, and then as the providers, we kind of see what does that patient need specifically. Do we need more frequent follow-ups with the dietitian? Do they need to meet with the health coaches for accountability? Our health coaches will go for walks with patients if needed, or meet people at the grocery store if they need some help picking out what is a more healthful choice. So whatever they need, we can help get them kind of lined up with.
That's awesome.
Yeah.
Great healthy alternatives and great nurse practitioners to help you with that. So where are you guys centrally located?
Our office is on South University here, just right across the street from the orthopedic hospital. The eye clinic is on the bottom floor, and we're just up on the second floor. So
awesome. Thank you guys so much for stopping by.
Yeah, absolutely.
This is a pleasure. So the information's right there on your screen, guys, and you guys can check them out at sanfordhealth.org. Now, coming up on our today's show, we'll be chatting with the Air Force veteran about the ways he served and served for us here in North Dakota Today.